I'm here talking to one of the authors of our latest briefing, which is Adult and Older Adult Mental Health Services since 2012, which is an analysis of the NHS benchmarking data. So I'm here with Andy, and I was just wondering if you could tell me a bit about it and kind of what you did as part of this work.
So we linked up with the NHS Benchmarking Network, who every year collect data about a whole range of health services, including mental health services. And since 2012, they've collected data from all providers of mental health care in England and Wales. And from that, we've been able to look at particularly adult mental health services, both acute inpatient bed-based services and the full range of community support offered by mental health trusts across the country.
Okay, and I guess, what did you find? What were the findings?
So we found that between 2012 and 2016, there was, as we would have expected, a reduction in the number of beds in inpatient services for people who need them in a crisis particularly, and that is roughly in line with what we'd expect. It's a long-term trend, although actually in the last year of the data collection it went up slightly. We don't know whether that's the beginning of a new trend or whether that's a one-off change. We'll see. The thing we also found is that over that time community services haven't increased, and some kind of community services have actually gone down slightly. And this is a cause of concern, because we know that where we're shifting care from hospital-based services to community-based services, we might have expected to see a rise in the latter.
Okay, so we're seeing, at a very basic level, we're seeing a decrease in the number of beds, inpatient beds, and not a sort of equivalent increase in community services.
That's right, and it's possible, of course, that in many local areas there's now investment going into primary care mental health services. And that might be providing an alternative to some people who might previously have been in touch with community mental health teams. And we've also seen during this period of time a very rapid increase in psychological therapy provision through the Improving Access to Psychological Therapies programme. So we need to see that while there are some things that give real cause for concern in this report, there are other things going on around it which are to be hugely welcomed. But I think there is a need to make sure that we've got that full range of services available in every part of the country. And some of the data we've seen here would suggest that we need to look again at that.
Okay, and as a result of that, what would you say are the kind of key policy implications, the calls to action? I mean, what do we want to see change?
Yep. So I think fundamentally we have a plan now. In 2016, the year that this data collection finished, the 5-year forward view for mental health was published. That sets out a range of recommendations for change, improving access to crisis services in the community, more early intervention, better community services across the whole piece. There's investment going into that that's been pledged by government. We need to make sure that that investment is actually spent as intended. Every local area of the country, clinical commissioning groups are putting that investment into these better mental health services to enhancing community support. We do, of course, need to make sure there are enough beds when people do need them, particularly in a crisis. But we need the whole range of services available, including in primary care, so that no one's left behind.
Thanks, Andy.